All right, how you doing today? I'm Greg Roskopf, and I'm the owner and developer. Sorry, trying to get my camera set up. The owner and developer of Muscle Activation Techniques. And basically, what we're going to talk about today, kind of a quick summary of the impact and the checks and balances that come with muscle activation techniques, and that allow us to really check our work. From a standpoint, regardless of whether we're doing training and setting our clients up on exercise, or we have stretching techniques or different modalities designed to increase range of motion. One of the things I always ask is, how do we know? How do we know if we have a positive or a negative effect when we put forces on somebody's body? And many times, we see our clients and we can have success with the techniques we implement, but then there's times that somebody just doesn't respond the way that we would hope. And to that point and to that degree, sometimes we need a little bit more checks and balances to determine maybe some of the things they're doing are having a negative effect as opposed to a positive effect. And so we're going to look at that from the checks and balances standpoint relative to muscle activation techniques. And first off is just defining, a background in muscle activation technique. Basically, muscle activation techniques, we look at the muscle system's role in chronic pain and injury. And we recognize that whenever you have stress, trauma, or overuse, the resultant inflammation alters the communication between the nervous system and the muscle system. And it's like having loose battery cables. The nervous system sends the information to the muscles and it just doesn't get there. And those muscles can't do their job to contract and contract on demand. And when they can't contract on demand, they can't do their job to stabilize joints and protect us from injury. And so basically that's what we're looking at from a muscle activation technique standpoint, is where we want to identify where these altered communication pathways are. I always say that like every muscle in the body has its own set of battery cables, and the communication pathways between the central nervous system and the muscle system. And in the ideal state, we want all of those cables connected and the muscles able to fire and fire on demand. But again, when you have stress, trauma, or overuse, it's inflammation that negatively affects the muscle's ability to contract and contract on demand. And what happens when a muscle can't contract efficiently, it can't shorten efficiently. And due to reciprocal inhibition, the opposite muscles don't lengthen as efficiently. So when a muscle, if I had my elbow flexors, if they couldn't, for whatever reason, they're overstressed, they can't do their job to contract efficiently, they fully flex, the opposite muscles will tighten up. So the triceps or the elbow extensors will tighten up when there's inhibition or altered communication to the biceps. And so the thought here is that tightness can be a sign of weakness. And that's what we look at with muscle activation techniques, is wherever you see a limitation in range of motion, it means that one or more of the muscles that move you into that position are potentially weak, that they can't contract efficiently to move you into that range. So we look at the opposite approach. Rather than tightness being, if I can't externally rotate my arm, it means that my internal rotators are tight. We look at it from the opposite standpoint, is that the external rotators can't contract efficiently, so they can't fully shorten, which in turn causes a protective tightening by the internal rotators. And so these muscles just, you get altered muscle function when you have inflammation or over stress on the tissues. And not only can they not contract and contract on demand, but the tolerance levels of the muscles decreases. Basically, their force tolerance levels decrease when you have inflammation. And the best thing that I can say is, like, if you sprain an ankle, you try and walk on that ankle, you can't put any pressure on it, because all the supporting muscles that are designed to support the muscles and create stability at that joint have been weakened. The inflammation has weakened those muscles, so they can't tolerate the forces of body weight anymore. So we limp, or we even need crutches for a time period. As those muscles get stronger, then the ligament can heal, the muscles get stronger, and then all of a sudden we can tolerate more force and there's less pain. And so these things go, pain and muscle dysfunction go hand in hand. Pain is a sign of inflammation. And so where you have pain or tenderness, it's telling you that there's inflammation. Where there's inflammation from a muscular standpoint, it's showing you that those muscles are not working effectively. Their force tolerance levels are lower, and their ability to contract on demand is lower. And so when we look at it, I'll go back to my history, and the one question that I always ask is, how do we know? How do we know that what we're doing with our clients, if we're doing mobilizations or adjustments or stretching techniques, any form of force being placed on the body, how do we know whether or not we have a positive or a negative effect? And the one thing I can talk about is from my own experience is when I was 19 years old, I had a fractured vertebrae and had a lot of residual issues. And by the time I was 25 years old, I had patellofemoral syndrome, plantar fasciitis, SI joint dysfunction. I had one injury after another. And I was trying to figure out what was wrong with me because conventional therapy wasn't working for me. And so I sought out specialists in every field, from chiropractic, physical therapy, massage, athletic training. I sought out specialists in all fields to try and determine what was going on with me. Why was I 25 years old, broken down, thinking, what am I going to be like when I'm 50? And so the common theme of anyone that I learned from back at that point was that you're tight. And I was tight. I could barely bend down to touch my knees, let alone my toes. And so I was chronically tight. But every modality focused on trying to increase that flexibility, increase my range of motion, whether it's through chiropractic adjustments, physical therapy, mobilization, stretching techniques, deep tissue work, whatever that would be, the focus of the modality was to increase range of motion. The problem was that every time I would stretch or get deep tissue massage, I couldn't get out of bed the next day because I'd have numbness and sciatica down into my big toe. And so I was negatively responding to these modalities that were supposed to be helping me, that were supposed to increase my range of motion and increase my flexibility. And so that got me, kind of trying to figure out, like, what's wrong with me? Why I understood the biomechanics of movements and the interrelationships of joints and how the foot, the ankle, the knee, the hip, the trunk, all the way to the occiput are interrelated. And if you have abnormal function in one joint, it could put increased stress and tension on another joint. So I understood the whole biomechanics of movements and all of the modalities that I was learning, I was implementing into my daily work with my clients. And some clients I would have success with, and other people, they reacted like me, where they didn't have positive effects. And sometimes they even got worse. So I was focusing on that. And I trusted the information that I was learning. So I'm thinking I was the problem. So I trusted all of this information that I was learning, had success with a lot of clients, and implemented into my whole education or my technique, and created a whole system that got me hired in professional sports. I was hired by the Utah Jazz and the Denver Broncos as a range of motion functional movement specialist, or biomechanics specialist for each of these organizations. And my focus was to increase range of motion and increase the strength through those ranges of motion through exercise. But some people got better and some people didn't. And I was one of those people that didn't. But it was my experience with the Utah Jazz, working with the team chiropractor, Dr. Craig Bueller. We would work on players together for hours, and we'd work together. And I'd come in and I'd assess range of motion and do my techniques to try and increase range of motion. Through his field, his specialty was clinical kinesiology. And so he did manual muscle testing. And I can always go back to there was one time I was working on John Stockton with the Utah Jazz, and I increased he was hip tight and hip rotation and hip internal rotation, and I increased his range of motion. I stretched out and loosened up the external rotators. His range of motion and internal rotation improved significantly. And Dr. Bueller came back and started testing muscles that were strong prior to me digging into to John's hip. And the muscles that were strong prior to us digging into his hip were now weak. And he turned to me and said, "What did you do? You just created weakness." And I was like, that can't be good. And all I think is him saying, what did you just do? And so that basically told me there's something, I just did something that had a negative effect on this athlete. And the only way I can say it is the last thing we'd want to do is if somebody's going out to run a 100-yard sprint, the last thing we'd want to do is apply a modality that is going to decrease or make them weaker and decrease their force output. And so that changed my whole perspective, is that I didn't know that I just made John Stockton weak. So how am I going to know whether I have a positive effect or a negative effect on our athletes when we work on them? And this is when I was working just with athletes. But the one thing that I was exposed to there was manual muscle testing. And so I started learning, identifying, through muscle testing, I started learning the clinical kinesiology tests, and I started playing around with the tests. But one of the things that I realized that where I talked about when muscles can't contract efficiently, they can't shorten effectively. And I started to recognize that wherever there was limitations in range of motion, there was coinciding muscle weakness. And that weakness was the cause of this tightness. And all of a sudden, being a range of motion specialist, I would test muscles related to where there was a limitation in range of motion, and then I would activate those muscles. And as soon as I would get those muscles activated, all of a sudden the range of motion would increase. So my focus and the foundational principle behind MAT is that, muscle tightness is secondary. It's a side effect of muscle weakness. It's part of the protective mechanism by the body. And the protective mechanism by the body is saying whenever the body senses instability, it tightens up as a protective mechanism. It's like when you walk on ice. The first thing you do when you walk on ice is you tighten up as a protective mechanism. And so this tightness, it was the natural neurological response is that when the body senses instability, it will tighten up as a protective mechanism. And so when there's muscles can't contract efficiently, they can't fully shorten, the opposite muscles tighten up, they protect you from moving into those positions of instability. And that created a whole new field. I changed on the fly. I changed everything that I did. I was a range of motion, functional movement specialist, and I started realizing that the tightness is the symptom, not a cause. And I was actually, I was focusing on the symptom with all the modalities, and some people get better and some people didn't. And it was the people that didn't get better that started really validating this work. And I go back to a quick summary of a guy with the Broncos came in with low back pain, and he was going out on the field. He went in his hip, he had tightness in his hips and internal rotation, and worked on improving his internal rotation. And make a long story short, he was more flexible, his back wasn't tight anymore. He went out on the field and pulled a hamstring. And I thought it's our job as specialists to make people better. If we're doing a good job, they should never pull a hamstring. This is over 20 years ago, but it made me realize that we don't know all the time of whether or not we're having a positive effect or a negative effect. And anytime you put force on somebody's body, how do we know whether it had a positive or negative effect? I can look back over 20 years later and say, we increased his range of motion, but he wasn't stable through that range of motion. And by having increased mobility without stability, he had vulnerability for injury. So it could have set him up for a hamstring pull. And so those are the things that we need to know. I think every practitioner out there has frustrating clients. It's like, they're not responding like my other clients do when with whatever modality we're implementing. And so with muscle activation technique, what we want to do is provide more checks and balances to say, again, how do we know? Let's see, maybe, if something does break down, if we have mobility without stability, we better make sure that they have stability through that newfound range. And again, we have to determine, how do we know? And with muscle activation techniques, we basically use manual muscle testing to determine, like I said, wherever there's a limitation in range of motion, it means that one or more of the muscles that cross that axis are potentially weak. And so when I put this whole process together, that's what I worked on. I'd go through and I'd evaluate clients and look at it and evaluate and determine where they had a limitation in range of motion. And then I started switching, instead of stretching the tight tissues or trying to do modalities to increase the range of motion of the tight tissues, I would activate the weak muscles, which is the opposite muscles. And like I said before, if we can't externally rotate, typically we stretch the tight muscles, the internal rotators. I would say no, actually the focus is the muscles that move you there. What muscles externally rotate the humerus and the infraspinatus and teres minor? You got muscles that have a primary function to externally rotate the arm. And if those muscles can't contract efficiently, the opposite muscles show up as being weak. And as soon as you would get those muscles to activate the muscles and get those muscles to be able to contract efficiently, i.e. tighten battery cables, all of a sudden it's like, oh, now I can contract through my range, full range of motion, and then through reciprocal inhibition, it sends an inhibitory response to the antagonist muscle, and the internal rotators would loosen up. And that was the foundational principles that I put together when I developed MAT. But what I didn't understand at the time, like I said, I trusted everything. I mean, I was a strength and conditioning coach at Fresno State, and I'm stretching athletes, and I'm doing all this work. And what I didn't understand at the time is when you put force on the body, it can have a negative effect. If it's inflammation that causes muscle weakness, stress, trauma, overuse, and the resultant inflammation is what alters these communication pathways between the nervous system and the muscle system. The inflammation makes muscles weak, and it alters the ability for muscles to contract and contract on demand. Inflamed tissues can't tolerate forces the way normal tissues can. In forces, we have to consider what is a force on the body and how does the body tolerate forces. And the biggest thing I learned is when I said every time I would stretch or get deep tissue massage, I couldn't get out of bed the next day because I'd have numbness and sciatica into my big toe. We were putting forces, the deep tissue massage, the stretching was forces on the body. And because my system was so inflamed, those forces were actually exceeding tolerance levels of the muscles, causing more inhibition, more weakness, and actually, in result, more pain. And so the things that I was trying to do to help myself was actually contributing to the problem. And so again, how do we know? You could have never told me that stretching can actually cause weakness, but stretching is a force on the tissue. And in a controlled environment doing muscle activation techniques for 25 years, I can evaluate through different forces on the body, did it have a positive effect or a negative effect? If I stretch, if somebody's hamstrings are tight, then and you stretch the hamstrings and you increase their mobility, you may have opened up a range that's unstable. Again, how do you know? With muscle activation techniques, we can test the muscles in their shortened position to determine whether or not these muscles are able to contract on and contract on demand. And many times I'll see that at a time, like with Craig Bueller, when I was working with John Stockton, there'll be times where we stretched him, stretched his hip, I increased his range of motion, and Craig Bueller came back and said, "What did you just do? He was strong before you did your work. Now he's weak." So he had increased mobility without stability. And that's not a good thing. And that's what I can say probably happened to that athlete that pulled the hamstring, is we increased his mobility. And he went out and put forces on his body in a weakened state, and literally within 5 minutes of being out on the field, he came back with a pulled hamstring. That's not what we're trying to do with our athletes. That's not what we're trying to do with our clients. Our goal with any client that we're working with is to try and make them better, to improve their overall physical health. And so we have to look at forces on the body, from foam rolling, dry needling, stretching, deep tissue massage, the therapy gun, the Theraguns, massage guns, vibration plates, exercise. Exercise as we know it. It's all force on the body. And how does the body tolerate these forces? And the one thing I can say from an exercise standpoint, the body's a great compensator. And typically we can get from point A to point B most efficiently with what we have to work with. So the body will compensate to perform movements that we're trying to do through exercise. especially when we're looking at compound movement. But the more isolated an exercise is, the less the body can compensate. And the more isolated it is, it's a force on specific tissues. If you exceed the tolerance levels of those muscles, negative things happen. The muscles will shut down, the communication between the nervous system and the muscle system will decrease. And again, how do you know? Because weakness is not a good thing. And the more inflamed our clients are, I think that from an MAT standpoint, I look at all the aches and pains that we relate to aging have to do with failure of the muscle system. And it's failure of the muscle system to be able to tolerate forces. And as the muscles get weak, progressively weaker over time, the tolerance levels get lower and lower, so it takes less physical stress to create an inflammatory response. It takes less physical stress to overload the tissues. Muscles get weaker typically as we age. And it's the neurological weakness that we're talking about. Can the muscle contract? Can it contract on demand? And you see people as they age and their gait patterns start to, shorten, and they shorten their stride length, and it looks like they're walking on ice because they're more unstable. The more unstable they are, their force tolerance levels are going to be lower, which means that things like stretching and deep tissue massage that you may be able to do when you're younger or working on high-level athletes, you can do that with many of these people and they recover. I always say you can do anything wrong with athletes and still have success with athletes. But it's when you, put forces, the same type of forces on people whose muscle system's not functioning at such a high level, then you can't put the same forces on them because it can have a negative effect. I was 25 years old and my body was acting like it was 50 because it couldn't tolerate forces, and deep tissue massage and stretching were actually having a negative effect. And so I never saw any long-term changes in flexibility until I got my muscles activated, my abdominal muscles that flex the trunk and hip flexors. The first time I got those muscles activated, I was able to bend down and touch my toes for the first time in 10 years. So it's the activation that takes away the protective tightness, teaching the muscles to contract and contract through their full ranges. Anything that we do, any force that we put on the body that negatively affects that will cause protective tightness. And then if you continue to put forces on those tissues, it will shout out in pain saying there's a problem here, fix the problem. So tightness is the first sign of neuromuscular dysfunction. Pain is the second sign. And that's what we're looking at. So the checks and balances, if we look at, the different, there's a woman that came in and, was a client that I'm just going to show quick screen. This is her trying to stand up. I said the body will get from point A to point B most efficiently with what she has to work with. She's using anything and everything she can to try and stand up. She was chronically tight, but her tightness, increasing her range of motion, wasn't going to improve her ability to stand up. Getting the muscles activated immediately, tighten battery cables, immediately improved her ability to stand up. But the catch here is when I say before and after, that was her after I got the muscles activated where she could stand up efficiently. To get the muscles activated, she can stand up efficiently. Then I had her go through her daily stretching routine. This is the first day that I worked with this woman. Then I had to go through the stretching routine that she was going through every day, and it made her weaker. Her force tolerance was lower. And I tested the muscles that we had treated to get her so she could stand up more efficiently. I retested those muscles after she went through her stretching routine, and it actually, all those muscles were weak and she was less efficient in her movement pattern. So that's pretty obvious. It's a total body stress. But from a neuromuscular standpoint, we can actually assess movement by movement, joint by joint to determine what muscles can tolerate forces and what muscles can't. So I'm actually going to take it off the screen here, and I said movement by movement, muscle by muscle, we can identify the body's ability to tolerate forces. From a general standpoint, wherever there's a limitation in range of motion, it means that one or more of the muscles that move you into that position are potentially weak. The opposite muscles tighten up. So if I have somebody with a limitation in hip flexion, so I'm checking his hamstring flexibility, I'm just going to stay on one side here. One side feel tighter than the other? So left side feels tighter to him. I'm hard when I'm standing here, but I haven't checked that. But Tightness in the hamstrings. What muscles would flex the hip? Basically the hip flexors. So from this position, I take him into hip flexion. He's limited. What muscles can't shorten effectively? The hip flexors, the psoas major, the iliacus, the tensor fasciae lata, rectus femoris, those are all hip flexors. When muscles can't contract efficiently, then it limits the ability to move through that range. And so the opposite muscles tighten up. So we look at the hamstring tightness as secondary to weakness. So now we can come in and test. This is a test for the psoas major. Hold up. And then lower division, psoas major, hold. That's a diaphragmatic division. And then I come in and I test his iliacus, hold. And I have no idea what's going to show up here. I just know that one or more of the muscles, hold up, are potentially weak. Hold up. And I don't know, I'm not pushing any harder. This is literally, can the muscle contract and contract on demand? So we have a tensor fasciae lata weakness. I've gone through, I didn't know, I haven't checked them before, didn't know what it would show, but the tensor fasciae lata, which is a hip flexion with abduction and internal rotation, I took it into its shortened position and it tested weak. The other muscles tested strong. So this is the psoas major. Hold up. I've been working in pro sports for over 30 years. And one of the things every year in camp with the Broncos, I see guys come in and their glutes and their abdominals. I mean, the hip flexors and glutes are typically the main weaknesses that I see. So one of the thoughts, they come in and they're tight through the hips or their back hurts. And so one of the thoughts is, oh, we need to release the psoas. That's one of the common thoughts is your psoas, the hip flexors are tight. With tightness, there's weakness, and inflammation causes protective contraction. So just a thought, if I come in, hold up, and I'm testing, I'm pushing pretty hard. He's got a strong testing. I have no idea what's going to happen here. Let me see one thing. If I go into his psoas, is that tender?
Yeah.
So tender, he's tender in that psoas. He does not like me pushing into the psoas. I'm not a release technique specialist, but I'm going into his psoas just, I mean, superficially right there, have no idea what's going to happen. Hold up. And he's still strong. So that force that I just put through a light massage on his psoas did not have a negative effect. What doesn't kill you makes you stronger. So any type of force that's put on the body, from exercise to deep tissue work, it's not saying what's right or wrong or what's good or bad. The question is, how do you know? And I don't know the answer to this, but we're going to find out. These Theraguns are deep. I mean, this allows me to get a little deeper into the massage. I'm going to go right into the belly of his psoas, where he's tender and inflamed. And he's not liking it. Luckily, you can't see his face. And this is actually in his belly. He's squirming. And this is what I used to do when I would stretch or get deep tissue massage. I would jump off the table because my tissue was so inflamed. Inflammation means vulnerability, that the muscles may not be able to tolerate forces. I don't know, but hold up. Hold up. I don't have to push very hard, and we didn't practice this. This is manual muscle testing. Can the muscle contract? Can it contract on demand? And his ability to contract was efficient prior. They could contract on demand prior to me doing putting a force on his body. The light massage that I did on the psoas belly didn't have a negative effect. The deeper massage that I did through the Theragun had a negative effect. So that means he's weak. So I'd take him here, hold up. Now with psoas major, I don't even have to really push, it's dead. Because when muscles can't contract efficiently, they can't shorten effectively. And in the most shortened position, that's where vulnerabilities show up. He had a limitation in range of motion in hip flexion. So it's saying one or more of the muscles that flex the hip are potentially weak. We found the tensor fasciae lata weak, but there was a vulnerability in the psoas, and I exposed that vulnerability. So if you think about it, any place there's inflammation, there's going to be tenderness. If we put forces on the tissues that are tender, that can cause a negative effect like that Theragun just did. The question is, how do we know? A less aggressive force didn't have a negative effect, so it's positive. But I was only able to know that because I was able to manually muscle test to determine whether or not it had a negative or a positive effect. Then I did the massage gun, and it was more force than his tissues could tolerate, and it caused weakness. And I come back, sometimes the athletes, young athletes, can self-correct while I'm talking, the body can go back, well, he's still weak. If he went out on the field and tried to sprint, there's more forces going through the tissues that are already vulnerable and weak. The body is going to first tighten up to protect from that. And second, it will shout out in pain saying, fix the problem. There's a weakness here that I have to compensate for, but there's too much force being placed on it. Then it will shout out in pain saying, fix the problem. So with any modality, it's not saying any modality is good or bad. It's just saying when we apply a modality, how do we know whether or not we had a positive or a negative effect? And with muscle activation techniques, that's really all we're doing. We're giving the checks and balances and the tools that allow you to say, you know what, that just had a negative effect. So you know what, through activation, I come back here, hold up, he's still weak. And then I come in and we palpate the origin insertion where it attaches to the lumbar spine and the femur, and we come in and get the muscles activated. I'm just stimulating the muscle after it's ironic because the stimulation of the muscle at the origin insertion increases the sensitivity of the muscle spindle, which in turn basically tightens the battery cable, which improves that communication between the nervous system and the muscle system. And so after I test the muscle and find a weakness, the brain is trying to associate. I have no idea how to resist that force that you just put on it. And now I stimulate the associated muscle that goes with that, that resists that force. And now the brain's creating an association between the psoas major and the force that was being applied. I come back and retest. Hold up. And he's strong as can be. Right there. And you know what? And I have no idea. Let's just see. How do we know whether or not he can tolerate forces yet? The muscle's activated now. But I'm putting the force on the body. I don't even know whether or not this will have a negative or a positive effect. Because sometimes it's almost like a vaccination when you get the muscles activated relative to a force. You teach the body how to tolerate that force. We come back. Hold up. Oh, and it shut it down again. So that's information. And the last thing I want to do is have him leave weak. And so if I do any type of stretching technique, mobilization, deep tissue work, Theragun, exercise, I have the ability to assess my work. I come back and get it activated. And the nice thing is once I come back and get the muscles activated, then I know he's leaving strong. So even if we do something that's a force on the body that exceeds the tolerance level, if it has a negative effect, what I can always say with muscle activation techniques is we can fix what we break. If we put a force on the body and the body can't tolerate it, we have the ability to assess and test it to determine whether it had a positive or a negative effect. If it had a negative effect that caused inhibition, and we go and get it activated, hold up, fix what we break. Now he's strong. Now we can regulate his exercise progression and know that he has a weakness or a vulnerability in his hip flexors. And then one of the correlating factors there, does that feel any better? So his range of motion improved and more symmetrical because we just got hip flexors. We still have a tensor fasciolata. We haven't addressed all the hip flexors that have shown up weak, but by increasing activation of his psoas, which is a hip flexor, it increased his range of motion in hip flexion. So the key today, what we're talking about with muscle activation technique, I mean, there are 276 muscles on each side of the body that we have the ability to test around joint by joint, movement by movement, to be able to assess, to determine, can these muscles move the joints the way they're designed to move? Structure dictates function. And it's a function of the muscles that dictate whether or not the structure can move the way it's designed to move. He was limited in hip flexion, not because he has degeneration in his hip, because the muscles that move him into hip flexion could not tolerate force, could not contract efficiently, which means their force tolerance levels were lower. and their ability to shorten was less, so the opposite muscles tighten up. In our view, for muscle activation techniques, tightness is secondary to weakness. And force on the body, whenever we put force on the body, we have to be able to know whether or not that force had a positive or a negative effect. It doesn't make anything good or bad. It just says on this individual relative to this group of muscles where we saw a limitation in range of motion, we have a vulnerability, and putting force on those tissues that already are irritated and inflamed can have a negative effect. It's information. It's information that allows us as specialists and practitioners to be able to progress our clients and make them healthy. The last thing we want to do is make somebody feel worse. And if we irritate tissue that's already irritated, which in turn causes more inflammation and more pain, then it's having a negative effect and not the goals that we want to have with our client. So that's where, I mean, MAT is an adjunct to every field. It just provides the checks and balances to allow you to determine, did the force we put on their body have a positive or a negative effect? So I hope that made sense to you. I hope you, understand the significance of being able to assess our work and determine that, whether we have a positive or a negative effect. And then the end result is to be able to fix what you break. If it had a negative effect, you just get those muscles activated and then they leave stable, more flexible, mobile and stable, more flexibility through greater ranges of motion, strength through greater ranges of motion. So you have strength and stability. And tied together, when you have strength and stability, your body will, it's like melting the ice. Your body will give you all the motion in the world. So thanks for listening. I hope that provides some insight, and have a great day.